Malpractice is rampant in our society. The types of malpractice and what they entail will be described so that we, as young adults, are more aware. Ways to manage and reduce the chances of will be explained so that we can be safer as a society. Let's start with the definition of malpractice. The prefix mal, defined by Merriam-Webster Dictionary, means bad. Therefore, the word malpractice literally means bad practice. Defined by Merriam-Webster, malpractice is careless, wrong, or illegal actions by someone trying to do their job. There are multiple types of malpractice. I will talk about 3 of them today. The first topic today is medicine. The next topic will be diagnosis, followed by surgery. Medicine, or incorrect medicine, is a serious issue because all that needs to be done is to look at the chart or record to ensure that medicine is not going to react with anything else that is prescribed or they're taking as a supplement. Ensure they're not allergic. It may seem minor because you already know what they're allergic to. However, this is very important, and both a liability issue and how you'll feel if it was in the chart and you missed it. For example, a patient allergic to amoxicillin. Can you safely prescribe a Z-Pak? The answer is yes, because it's in a different family of drugs. Misdiagnosis, or telling the patient they have something they don't really have, and missing what they do have. One way to prevent this is differential diagnosis. Differential diagnosis has 4 basic steps. First, gather all information about the patient and create a symptoms list. Second, list all possible causes for the symptoms. Third, prioritize the list. Lastly, rule out or treat possible causes, beginning with the most urgent. However, this could also be treated as defensive medicine, and I'll get back to this topic later. Occam's razor is a method of solving problems created by the late William of Ockham. It reads, "The simplest explanation is usually the correct one." Unfortunately, being medical students, this may be true, but you still have to be able to check. It's time to move on to our third topic of the day, surgery. Surgery has an enormous amount of malpractice areas surrounded with it. This doesn't mean don't be a surgeon. By all means, they make an extreme amount of money. This just means don't be an idiot. The first malpractice issue with surgery is wrong site surgery. This is unacceptable, and it's easily fixed. The first step is to ensure all documents have been reviewed before the operation to understand what has to happen during the surgery. The second step is to mark the operative site. This seems minuscule, however, we don't want to take the wrong leg off. The third step is to take a timeout period just before starting to ensure that everything is correct and everyone knows what needs to happen. If just one person isn't understanding, it can cause major issues. Along with wrong site surgery is leaving instruments or foreign objects inside of patients. This is just as unacceptable as wrong site surgery. Not being numb or knocked out, also known as unconscious, shouldn't happen either. This is as easy as talking to the patient just before starting. There are 4 topics left for today: defensive medicine, legal, strategies, and our parting of ways. Defensive medicine is against the law in Europe, and they do fine doctors for practicing it. Some of the harmful effects of defensive medicine include creating new strains of bacteria because of the overprescribed antibacterial drugs. Defensive medicine is also known as reactive medicine. Our next section deals with the legal side of things. Hospitals annually spend $17 to $29 billion for malpractice. Malpractice is only filed against 1 out of every 14 doctors, according to the New England Journal of Medicine. The same study found that only 20 cases result in a payout. The final section is strategies. With talking to the patient, remind them they can ask questions on any diagnosis or medicine. If you are unsure, or unable to care for a patient because it is outside of your area, refer them to somebody else, like a specialist. Invite the patient to research about the topic and have a true discussion with you. And the final word of advice is to pay attention to the patient, what they have to say, and their medical record. Malpractice is horrible. However, it can easily not occur in most cases. Easy steps are to ensure the patient isn't going to have a reaction to medicine. Remember Occam's razor, but also your duty. Everyone should know what's going on in surgery. Have a good evening. Thank you for listening.